everyone, welcome back to my channel. This channel is for people with insomnia who want to finally overcome their insomnia and get the sleep that they need. In this video, I'm going to be talking about all things anxiety as it relates to insomnia. I'm going to give you my tips on how to deal with insomnia, and then at the end, I'm going to talk about one of my clients' transformations who had really bad general anxiety on top of her sleep anxiety. And I'm going to share with you her tips that she has for you if you are dealing with anxiety. Now, when we have insomnia, we tend to develop sleep anxiety. Anxiety in general develops as a reaction to our own emotions. So when we have insomnia and we have that worry, we have that fear, we have that frustration, we tend to develop sleep anxiety over time. And this happens the more and more we try to use all these quick fixes like supplements and pills to try to fix our insomnia, and then they don't work and they leave us even more frustrated, even more worried, and have even more fear. And then the anxiety just builds and builds and builds and builds. Now, something that not everyone realizes is that everyone experiences anxiety at some point in their life. Some people have it pretty mild and some people have it pretty severe, but it happens as a reaction to the different stressors that we have in our life. It's when that anxiety affects our day-to-day living, that's when it's considered an anxiety disorder. Now, if you're someone who isn't quite sure if you experience anxiety or what it's like or what the symptoms are to watch out for, I'm going to list off a bunch of the physical and psychological symptoms. I want you to listen to them as I read them and identify how many of them you might be experiencing. That can give you a clue as to whether you have anxiety. Of course, a medical professional is the only one that can diagnose that. But here we go. I have a list on my paper. I can't memorize it, so I'm just gonna read it off of here. So, first one, feeling nervous, restless, or tense, having a sense of doom, increased heart rate, shortness of breath, sweating, dizziness, ear ringing, trouble concentrating, trouble sleeping, gastrointestinal distress, and more. There are a lot more symptoms that you can look up if you just do a Google search about anxiety, but that's just some of the main ones that you could be experiencing. So I'm curious, do you know if you experience general or sleep anxiety? I want you to comment below with the word general if you have general anxiety, comment with sleep if you have sleep anxiety, or you can write both if you have both, or what you suspect you may have. So let's move on to some tips on how to deal with the anxiety, and these tips can help with both general anxiety and sleep anxiety. So first off, I want you to realize that you are safe. Nothing bad can happen to you. I know it feels like it feels intense, it can feel scary when you have anxiety, and also if you're experiencing panic attacks. So the best thing that you can do when you experience both general and sleep anxiety is to not fight it. When you're in the middle of it, there's no way to stop it, and trying to suppress it or trying to make it go away, trying to not experience it is only going to amplify your experience, and it's going to make them last longer and happen more frequently. But the more you can just be with it, be with the uncomfortable symptoms and feelings and emotions and just allow it to happen, the less intense it's going to be and the less frequently it's going to happen. One analogy that you can think of is if you're in the middle of the ocean and you have a big wave coming at you. If you're trying to like flail around, trying to get away, trying to stop the wave, it's only going to be a more intense experience. But if you can just allow the wave to pass, ride it out, your experience is going to be much more smooth. Another thing that you can do is when you're experiencing that anxiety is to just lay down somewhere. It can be in bed, on the floor, wherever you're comfortable. You're going to put your hands over your heart just because it's a comforting position, and just breathe into it. You can close your eyes and just breathe into it. You're not trying to make it stop or relax yourself so it stops. You're just going to be with it and breathe into it. And just allow it to happen. Now, another tip I have for you is when you notice that you're starting to feel a little anxious, your mind's racing, things going on, is to write things down in a journal. Just get your thoughts out, get the messages from your brain out onto paper, and that can lessen your experience as well. So if you need some extra support when it comes to anxiety and insomnia, you're going to want to click the link in my description for my free 5-step guide on how to overcome insomnia. This guide is going to help you to understand more about why you have insomnia, why you're stuck, and why you experience sleep anxiety. If that's something that you feel like you need, make sure you click in the description box for that link and download it while it's still free. So now I want to move on to talking more about one of my clients that I worked with who had pretty severe general anxiety on top of her sleep anxiety. Of course, she wasn't getting sleep and she had insomnia. So I'm going to list here what she experienced prior to working with me. So she was a highly anxious person even before insomnia. And the symptoms that she had were nervous butterflies, chest pain, heart palpitations, sore tongue, which is a symptom that people actually get when they have insomnia or anxiety. And she was sleeping less and less and averaged about 4 hours per night. Now, she developed sleep anxiety, of course, because she wasn't sleeping. She had insomnia and she felt physically and mentally awful all the time. So when she came to me, I knew this was going to be a more challenging case, but I was up to the challenge and I have worked on my own anxiety and I've worked with other clients with anxiety. So I was excited to work with her and help her move through it. Now, just like everyone else who has insomnia, she has tried sleeping medications, she tried supplements, she tried a naturopath, she tried acupuncture, she tried just about everything that she could try, trying to find that one magical supplement or one magical thing that will work. So let's talk about where she's at now. So she isn't quite finished with her journey, with her recovery, but she's come quite far in the past couple of months. So she still has general anxiety, just like everyone does. Well, not everyone experiences general anxiety, but everyone experiences anxiety, and she does have an anxiety disorder. So she's not going to be able to get rid of that completely, but her general anxiety is much lower. She still has some hyperarousal, but it is much lower than when she first started. And she has no more physical symptoms, or they happen rarely. She did mention both. She falls back asleep now where she wasn't able to do that before, and she's getting between 8 and 9 hours of sleep every night. She started on average 4, so that is amazing. One thing I forgot to specify is that she's in my online self-paced program, not the one-on-one coaching, but she did ask lots of questions and I answered them through email inside the course and really helped her along the journey, and she got those type of results. So that is absolutely amazing, and I am so proud of her and so happy for her that she's getting the sleep that she needs finally. So one common symptom that we experience when we have anxiety is we'll have these negative thoughts in our head that are very self-critical and not making us feel very good. I created a whole video about these thoughts that we experience and how to deal with them. Definitely check out this video. You'll find it very helpful if you do experience this, or maybe you'll like this video. Thanks for watching today's video, and I'll see you in the next one.